I was burning out, and I realized not because of the actual work, like the work was fairly enjoyable, but it was more the other stuff, the administrative stuff, the notes, the tasks, the insurance forms, the disability letters. And so, there has to be a way. But actually getting in front of doctors is hard. And then just the education piece as well. I think a lot of us are so used to how we work that sometimes changing that, even if for the better, can be a bit challenging.
The whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and chief medical officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. All right, so today we're joined by Dr. Zaahir Moloo, family physician and serial entrepreneur. He's the founder of Hello Mental Health, a virtual mental health counseling service here in Alberta, and most recently the co-founder of ScribeBerry, which is an artificial intelligence scribe and medical documentation tool geared at physicians. Dr. Moloo, thanks for joining us.
Yeah, thanks for having me, Jordan. Yeah, it's a pleasure.
So you got your hand in a lot of different things. What does your week actually look like in terms of like hours? Are you running businesses? Are you seeing patients? What does it actually look like?
That's a good question. Nobody ever asks me. So like in terms of my week, I do like part-time work at Hello Mental Health. And so that probably takes up maybe around like 25 hours of my time. But being in virtual, it's a little bit less administration heavy, so which helps. And then the rest of the time is really dedicated to ScribeBerry. And sometimes it's a bit more one way or the other. And then I try to keep as much free time as possible, which is actually the motive for creating ScribeBerry, more to spend with family. So yeah, that's kind of the way I guess it lays out.
Well, I mean, just the administrative burden, the charting, like it's a huge problem across the entire sector right now. Like people are spending a ridiculous amount of time, like after hours, it's cutting into their family time. Like this is, if not number one of the top couple problems currently facing like physicians and medicine in general.
Definitely. I mean, I faced it firsthand, which is really like the motivation for starting a tool like ScribeBerry. And I think just kind of being on that other side and having your day kind of be dictated by paperwork and charts, I think that was a big motivator to kind of, launch something like this.
So for the platform itself, for anybody who's never actually seen the product, or for anybody who's never heard of these AI ambient scribes before, I mean, I think these are like the coolest new thing in health tech. Like the first time I saw one of these platforms, probably like 6 months ago, it absolutely blew my mind. I was like, okay, the game has been changed.
For sure.
But essentially, it listens to your patient encounter, be it virtual through the phone, the computer, or just in the room, you have it recording with a patient. And then it takes the whole thing, it transcribes it, but then it actually processes it. So, most people are familiar with Dragon, the old medical dictation software, things like that. Everyone's seen these before, seen them in hospitals, but this like adds that next level of artificial intelligence onto it. And it takes the whole transcription and turns it into an actual SOAP note or any variety of format of notes and outputs it directly. So you're not having to like go through and manually turn things into that format for your patient charts. I mean, how did I do on summing that up?
Yeah, I mean, that's pretty good, pretty accurate. I mean, we have the live scribe, but that's just one of our features. So with ScribeBerry, I mean, that's definitely like probably the most popular feature, but it's not the only way to generate documentation. And so for us, it's like we really wanted, the opportunity and the ability to really capture the physician's workflow however they want to generate notes. So whether that's dictation, whether they're working offline and wanting to upload audio files, kind of like old school dictaphone style, whether they just want to take scratchpad notes and turn those into any, documents at the end, and then we have features where you could chain notes into each other. And so if you generate a soap note, you can take that soap note and turn it into a letter, or into a patient handout. And so, yeah, it's been quite the journey, and definitely like the biggest challenge, has been educating docs on that.
I mean, we've seen the same thing just dealing with Cherry, right, in our business. That's like the
Yeah.
primary bottleneck is just how do you actually get in front of doctors? Like, there's so
Yeah.
much incredible tech. And I mean, this is a prime example, right, with ScribeBerry, right? And it's just such a closed off community, and it's very difficult
for
to
sure.
actually get that word out there.
Yeah. I think once docs like see it, probably with Cherry too, like once they see the value and you're in front of them, it's almost instant, right? They're like, whoa, this is amazing. But actually getting in front of doctors is hard. And then just the education piece as well. I think a lot of us are so used to how we work that sometimes changing that, even if we're the better, can be a bit challenging, right? So,
Yeah, once you get there, though, it's a no-brainer. Like, oh my goodness, this is incredible. Revolutionary.
Yeah, exactly.
But yeah, I've been using it personally, for my own patients this last like month or so here. I'm really enjoying the ScribeBerry platform.
Nice.
Personally, I've been using it for like the ambient scribe and the summary notes. What else can it do? You mentioned the dictation side of things. I saw there's something else, the ADA or something. What did that refer to?
Yeah. So we just launched ADA. So we, in terms of feature set, I mean, we have so many features. It's hard to really like summarize into one concise blurb, but you can essentially do literally anything. I'll start with ADA. So ADA is kind of this autonomous assistant that we launched. You can kind of think of it like a pre-triage kind of assistant. And so how it works is, the clinician can actually launch this and send it to their patient. And ADA will actually collect a history from the patient, and bring it back to ScribeBerry and have the note ready, the HPI ready before the physician even walks into the room. So in practice, how docs have been using this is, they'll get ADA to talk to the patient, either when the patient initially books in, or, in a family practice, for example, while they're seeing one patient and you have like 3 patients waiting in the other rooms, ADA can at least, get that history beforehand before you walk in. And so, yeah, it's a huge time saver, and it just kind of adds that extra layer of kind of AI scribe, I guess, to ScribeBerry. So,
How do you actually interface it with the patient? Is this something you email them ahead of time and they can do remotely? Or you said even in the clinic, you can give the patient access like to the computer or to an iPad or something with it running on there?
Yeah, exactly. So it's either or. So you can either send them a link. They can either scan a QR code in the clinic, or if you have it open on a separate device, you could just launch it and hand that device over. So we have clinics using it all sorts of different ways. And with it, we're adding, in the next week or so, the feature to be able to customize that experience as well. So either add medical context to that discussion before it happens, or even add the ability for the doc to add their own questions. Like we've had some psychiatrists who want to ask like a GAD-7 or a PHQ-9 in addition to like taking the history. So that's kind of where we're at with that, but it's been hugely popular so far. Yeah.
Very cool. And so you can sort of set up a custom journey, different intake questions. How does the patient interface with it? Text-based, or it's all audio-based?
No, it's legitimately like speaking with an actual pre-triage assistant essentially, and it would just launch, and the first line is, "Hey, my name is Ada. Feel free to talk to me like you would an actual human. What brings you in today?" And then based on what you say, it'll kind of adapt. And I mean, we've tested this extensively and thoroughly, but you can try and trick it as much as you'd like, but it won't get tricked. So if you start saying, I have a headache, and you're like, actually, I lied, I have allergies, it'll actually recognize that and switch gears, and not judge you for it. So, it's been quite a journey.
No doubt. Well, and so if anybody who hasn't seen it again, this is a platform that runs in your web browser. So just, within
Yeah.
Chrome, you pull up the platform. You don't really need any like special downloads or any software running on your computer. Is there an app, or is it all web browser based
Yeah.
and you can do it on your phone or your computer or wherever?
Yeah. We don't have a dedicated app yet. That's being built out right now. So it's coming. And that's just based on user feedback. They'd prefer to have that, but you can run the web browser on your phone as well. Some devices we can't control. Every device. Most devices it works really well with, mobile wise, and then some devices or some docks who, their phone auto shuts off because of their battery settings. In some cases, we actually have the ability for the doc to then maybe record offline and bring the file in, assuming they can do that in a privacy compliant way. So that option is there as well. And so, yeah, we've just kind of left it open for now and kept it simple with the web app. So, yeah.
Right on. Okay. How did you get started on this anyways? I mean, that's a pretty big pivot career-wise, going from
Yeah.
medicine into AI and tech. Like, how did you even make that jump?
Yeah, I think so. I mean, in terms of like me personally, first off, I mean, I've always had an interest in tech in general. So from a young age, that's kind of been there. And then specifically with ScribeBerry, I think, so I had my own family practice in Spruce Grove. So this was through COVID, and 1,800 patients. So it was really large, and I was burning out, and I realized not because of the actual work, like the work was fairly enjoyable, but it was more the other stuff, the administrative stuff, the notes, the tasks, the insurance forms, the disability letters. And so, there has to be a way. And so that kind of launched the initial idea of ScribeBerry. I ended up creating like a no-code version of ScribeBerry, a really primitive version. I couldn't put PHI in there. It was very like primitive, not really privacy compliant at that point. And then I was using it personally, and I approached one of my friends, my co-founder now, Aman, and he's a software developer. We've been friends for forever. We play soccer together. And we're like, hey, let's actually build this out and see what happens. And that's kind of how it started. So, yeah.
And what was the initial version? I remember seeing it on Facebook for the first time, like right around when ChatGPT like 3.5 launched. Is it OpenAI and Microsoft sort of as the back end?
Yeah, so we use a combination of different things. So we use Microsoft Azure, so a hosted kind of model on our own private kind of server. That's location dependent on where the physician logs in from. So if they log in from Canada, our backend server is Canadian. If they log in from the States, it's through the States. And then we use a combination of different LLMs, and we have a number of rules set up based on use case and privacy and a whole kind of whackload of different rules depending on those things, to kind of figure out which LLM to use and what specific kind of training parameters to use with that. So yeah, it's a bit jumbled up, to be honest. Yeah.
So it's not like one LLM powering the whole thing. Like, it sounds like it changes model depending. Is it maybe on the use case and which template you're using, which field of medicine you're in, or how does it actually change that on the fly? What makes that decision?
Yeah. So it depends on a number of factors. One, where you log in from, right? So region wise, which LLM we hit. It depends on which template you use. It depends on the length of conversation. It depends on just kind of customization of the user's templates. So if they have certain kind of things that they want in their own templates, then we can kind of gate the LLM in a certain direction. So yeah, it just kind of varies based on those specific factors.
And Dare I ask, how does a LLM actually work? I don't know if you know a whole lot about what's in the hot dog and how the
Yeah.
AI actually works behind the scenes.
Yeah, I mean, in general, the best way to sum it up is the LLM will predict um, the next word in a sequence, right? So based on the tech, essentially what it's doing is it's taking into account whatever information that's being fed, and it's giving you the most probable kind of answer. So um, if you ask it to, hey, create a note using this context, and you provide it this context, and you say put it in SOAP note format, it'll predict like, okay, what's, in the subjective section, what's the most likely next word supposed to be, and then it will populate that based on the highest probability. So then it's just kind of constantly doing that, and so yeah, that's kind of a more, I guess, a more easy way to kind of understand it, I guess.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today.
It literally just guesses at the next word. It doesn't really understand medicine or things like that. It just is based on previous conversations it read and data it was fed, assumes what the next output would be.
But you have to understand too, like LLMs in general, at least like high quality large language models, they're essentially trained on like more data than anyone can ever read in their entire life, right? Like literally the entire internet. So, you're kind of taking an unlimited amount of knowledge and kind of putting it into one of these things, and then further from our end anyways, further training it and again kind of augmenting it. So yeah, that's kind of what really drives that predictive sequence with such accuracy, right?
And then do you know in terms of like how it actually runs, like Google or Microsoft, they have their giant supercompute complexes that I think build the LLM, but then it's like its own little separate thing that can now run on a normal server, or does it still need to run on a giant like cloud compute server rack, or where does ScribeBerry actually run off of then?
Yeah, so I mean, we're Microsoft for Startups partner, so we use Azure for all of our backend stuff essentially, and so I mean we have GPUs running and a backend set up. In terms of how large, I mean, honestly, I'm not too sure. Like, Aman would be a better person to ask on the tech side, but I mean, financially, it's quite a hefty hit. So I'll tell you that. But yeah, we've been fortunate. We've had the Microsoft for Startups kind of credit and essentially funding, which has really helped us out. So. Yeah.
Well, that's awesome. Thank you, Microsoft, for subsidizing Canadian healthcare here.
Exactly.
Great deal for all the physicians thinking about signing up.
Yeah, exactly.
And then, okay, so you had the first version, scrapped it together, just sort of proof of concept, MVP, didn't put any like patient health information in it beyond just, I would imagine, the transcription of the call. How did you take that and...
Yeah, so that initial version didn't even have a live scribe in it, which is actually alludes to my first point. Like we didn't actually launch as a live scribe. Like that was just one feature. What it did, and it was actually hugely popular, was you could input any small commands. Like you could just say, write toenail extraction, and it'll give you like a full templated out note for that. Or you could kind of just mention scratch pad like notes, like, hey, today I saw this patient with this complaint, and it would turn it into a note for you. So we didn't even have the live scribe feature when we launched. It was just more that GPT style natural language note creation, essentially.
Very cool. Okay, and then this is what it's turned into now with the extra AI pieces on top of that, turning out the patient handouts. Very, very
Mhm.
cool. How many doctors have actually used the platform at this point?
Yeah. So last I checked, we're over 9,000.
Holy.
I could share my analytics screen too. I don't know if you want to see it.
I'll trust you. If you want to pull it out,
Yeah.
go for it. But that's an
Um,
incredible amount of growth in that period of time. That's amazing.
yeah. Yeah. I mean, we've been hugely popular, and we haven't honestly done a lot of like, traditional marketing in terms of Facebook and, Google ads and whatnot. We have dabbled in it a bit, but it's mostly been a lot of outreach from our end. Um, Facebook, has been huge, and word of mouth.
Mhm.
And so it's just been a combination of those things. And then as it spread, we've started spreading to the US. And so that's probably around 20% or so, 20-30% of our user base. And then other odd countries as well. I think last I checked, third place was the Czech Republic, which honestly we haven't targeted at all. So I don't know where that's coming from, but yeah, it's been kind of taking off in random directions. So yeah.
That's amazing. I can't think of the last time anybody got 9,000 doctors to do anything.
Yeah. And I think one of the reasons too is like we're multi-language, right? So you can have conversations in any language, and you can have the note generate in any language if you'd like as well. So I think that's kind of added to the appeal, especially in Quebec, and especially in kind of Europe as well, like some other countries. So
With a platform like this, you mentioned a little bit about the privacy and the security side of things. What goes into it behind the scenes to ensure that that patient data remains in
yeah,
place and untampered with?
of course. So I mean that's kind of really the foundation of ScribeBerry in terms of what really is sets it apart, because anyone could go to ChatGPT, not recommended, right, and start putting in data. Um, but yeah, on the privacy side, so we actually hired a privacy auditor initially, um, and I mean I could walk you through the data journey if you'd like, but um, we essentially have strong kind of third-party agreements with any vendors we use to protect health information. Everything is kind of siloed off, encrypted end to end. We actually can't see any notes or any of that data. And everything is kind of at the end of the day controlled by the user or the doc using ScribeBerry. So as soon as they delete a note, it's gone forever. And we leave that in their hands, and then just have a number of stringent protocols on our end to kind of protect that as well. So yeah, I mean, I'm happy to kind of go through the entire sort of process, but that's kind of it in a nutshell. And then we have specific, again, rules and regulations depending on where people log in from. Like, for example, in Quebec and BC, are a bit stricter in terms of their privacy. In Quebec, obviously near legislation as well. So we constantly review that and kind of make changes to those rule sets, which LLMs are used, where the data is housed and how it's housed, and just depending on all those various factors. So, yeah.
No, great summary. And okay, so you started out, you had your own first version, and then you partnered up with your co-founder. How did you take it to that next step and actually get to the point of being like a commercially viable product?
Yeah, for sure. So on the privacy note too, just as before I move on, so we're actually in the next few weeks we're going to be launching like an entire privacy and trust platform, where docs or any large organizations can actually just go to our website and download all of our documentation and essentially review all the various protocols that we take and how data is kind of stored. But yeah, back to the question. So we started off just free. We're like, hey, let's just test it out and see what adoption is like. And then very early on, like within a week or two, we're like, okay, we should monetize this.
Quick signal.
Yeah. We're like, okay, this is nuts. We had server capacity issues, like just right off the bat, and so yeah, it's just kind of a natural decision, right? Like, okay, we've obviously had something of value here. And initially, I mean, our price was all over the place. We started with like $39 a month, and then very quickly we're like, okay, we got to up this, and then we went like to $149, which kind of slowed things down, and then we kind of brought it back. So yeah, it's just kind of playing around with that a bit.
A discount code you want to shout out for anybody listening?
Yeah. If you go in and type in never chart again, just all one word when you subscribe, it'll actually discount your subscription 20%. So $79 a month or $7.99 a year. And we don't have any tiered pricing or any complicated stuff like that. Like, it's just straight up, you pay and you get everything.
Today's episode was sponsored by Fomaderm. Fomaderm is an advanced compounding base for topical drug delivery, proudly developed by researchers right here in Alberta. Unleash the power of topical diclofenac with Fomaderm's nanotechnology to improve skin delivery, ensuring precision and efficiency. The non-greasy, water-based foam formulation is preferred by patients and lets you use significantly lower concentrations of diclofenac to reduce skin irritation and side effects. Elevate your patient care with Fomaderm. Visit www.rstherapeutics.com today to receive some free samples.
So
nice. Okay, there you go. All right, a little nugget for anybody listening here. And then how many people are actually working on it at this point?
Yeah, so it's me, Aman, and we have a dev. Shout out to Ben. To be honest, it's us three, and because, I mean, that's been one of our strengths in terms of scaling and feature development and growth. We don't have any investors, so fully self-funded and bootstrapped, and we've purposefully kept it that way so far, despite a lot of interest. And the reason is just we want that full autonomy, the ability to pivot and change however we'd like, and just scale and grow. So, yeah.
Not having to deal with the influence of a board. No, that's incredible. Honestly, like, if you can bootstrap it, like, that's fantastic.
Yeah. So, I know like a lot of other Scribe companies are going down that route, and I mean, they're good tools. They'll probably be successful with that as well. But yeah, we just chose a different path. Different way of doing it. So,
what's been the hardest parts to overcome so far? The biggest business challenges now in this AI space, which is relatively new to the medical world?
Yeah, I think first is definitely the marketing side, right? Like, even for us, we're kind of learning as we go. So that's been a huge challenge. Docs are very private and personal as well, so reaching out is often hard. That's number one. Number two, on the tech side, so feature development, I think, would be one, and just keeping up with that. And we have so many ideas and so many new things coming out, like whether it's integration, whether it's more, just building out features. Like we're going to add in like PDF scanning and OCR kind of text as well. And then the second kind of big thing has been like just responding to feedback and building out and fixing our platform. So for example, initially when we launched, you could only do like up to an hour and a half of conversation at ScribeBerry. And now, we opened it up within those first few weeks when we got this feedback to about 7.5 hours. And so that's just one example of something that, we had to fix pretty quickly. So yeah, it's just those small things as we've kind of grown.
Making the adaptations on the fly. No, that's fantastic. Being like adaptable and quick and nimble like that.
Yeah. And that's the benefit of it, right? Like yesterday you messaged me like, hey, does it work with Zoom? And then, I spent a few hours and then we fixed it. And now we'll probably just post a blog about it and be like, hey, and it took like less than 24 hours. There's no board involved. There's nothing. Like, it's just us. We can do these things really quick and kind of move, right? So
this might be the best tech support customer service I think I've ever experienced.
Yeah. And on that, we have a 24-hour live person, who responds to any docs. So in our app, you could just click need help and then you'll actually talk to a person instantly. So that's something as well. It's all been about like speed and convenience for the user. Yeah.
Do you ever get any resistance or hesitation? You talk to somebody and they're like, okay, I don't know if I'm ready for this yet. This sounds a little bit crazy. What do you say?
Oh yeah, all the time. I think I mean, I think you kind of have to realize like, okay, the product's not for everyone, right? Even though like I see
It
that
should
value,
be.
maybe
It
they
should
don't.
be though.
Yeah, yeah. So I mean, we're not pushy. We say, hey, try it out. Here's a demo. Here's how it works. At the end of the day, if you want to go with a competitor, do that. If you don't want to use a scribe, don't. A lot of the hesitancy has been around privacy, understandably, and so hence why I think like in demos being able to explain that face to face really helps. But now just launching kind of a new kind of initiative where we'll actually make all our HIPAA controls available and have that kind of trust and safety there as well, just publicly visible, anyone can access it anytime. I think that'll help as well. So
Yeah,
yeah,
the being a little bit more aware of all the privacy and everything that's gone on to like maintain that data security might make people a little more comfortable.
exactly. Yeah.
I mean, it's just given the explosive viral growth of the platform, have you guys ever thought of like having a referral program? Like each you get send it to a friend and you both get a month for free, throw some fuel on that fire?
So we have actually a really good referral program. I don't know if everyone knows about it, to be honest. Like we sent out an email, and so if any ScribeBerry users are listening, if you refer a friend, they'll get that 20% off discount, and then however many people you refer, you get 10% off currently. So if you refer 10 people and they sign up, essentially ScribeBerry would be free for you for life until you cancel. So yeah, that's a pretty good incentive, we feel.
Yeah, no, that's awesome. That's probably been a huge factor. Right on.
Yeah. So yeah, we've tried to think of
Changing
different
the
ways.
world one bit at a time here, helping the physicians with that admin burden get home to their kids faster. I mean, anything else you think people should know just about the new AI scribe tech coming out?
Yeah, like we we talk about like the benefit to docs, but I think the other side is the benefit to patients. Like we've had a lot of patients reach out and say they actually really genuinely are happy with this because one, they can spend more face-to-face time with the doc. Two, they understand their visits better, and I think it's been kind of a huge help in that way as well. So just another angle to kind of think about it from.
Oh, absolutely. Like I personally, was always guilty of being a typer during the patient encounter, right? And it just lets you be that much more present, paying that much more attention, that much more focus. So I imagine from the patient experience perspective, this goes a long way to actually improving that physician-patient relationship.
Yeah, we hope so. Like, so in terms of research, we've paired with a few different groups, some residents as well, to kind of validate what we've seen internally. So that's in the works to kind of actually put out that, high quality evidence, but just subjectively in terms of surveys, patients love it, doctors love it, saving an hour to two a day, 50 to 80%, documentation kind of burden, reduction and kind of time spent there. And so it's been pretty good so far.
Yeah, no doubt. Yeah, you must be like pretty proud of yourself in terms of just that systemic impact. I mean, honestly, I think it's an amazing tool.
Yeah, appreciate it. We try our best. Yeah.
This is exactly the kind of stuff that the Canadian healthcare system needs, right? Like it's just such a big blind spot in terms of workflows for physicians, and it really does solve a huge problem. Like again, I can't speak highly enough of it as having used it personally. Like it really does revamp your workflow and just make things so much simpler. So I thank you to you and the team for getting on top of it and bringing this out there.
Yeah, no, I mean, thanks for using it. And if you have any feedback at all, just hit up the live person or email us or let me know too. Is there anything like you wish like it had, or anything that you've kind of noticed, or?
So far, not really. I mean, like the fact that you can custom tailor everything that you're doing afterwards, like you can feed back in a prompt and it knows the entire, patient encounter history, and then it goes back and reformats it however you want, or it like expands on a section if you thought it was a little bit light on detail in one area, or it'll add in a new section. I mean, that pretty much covers most of it. Can you set up your own template? Like, can you have that in
Yeah.
there?
Yeah, you can. So you can essentially set up your own style. Like I have one for Hello Mental Health, actually. That if I put in kind of one or two words, it'll generate out an entire template. So you can set it up however you'd like, essentially.
That's the one thing I haven't done yet. So I've been going back and telling it to modify it. So I'll just have to like incorporate. So he's already got the answer for
but that's on purpose, right? So some docs are like, hey, we want to set this up beforehand, and they're really specific. Some docs are like, hey, I want it really accurate. I want everything bullet point form. Like, don't hallucinate at all. And other docs are like when we made the change actually to our default, SOAP note to make it more accurate. Some docs got mad. They're like, hey, before it was giving me, these hallucinations, and sometimes they were kind of helpful, So what we did is just, it's up to the doc. If they want their note super accurate, they could have it that way. If they want their note to expand and kind of, they want to go in and talk back to it with natural language or manually edit it, they can. And so we've kept it open again, just with the doc in mind, to be able to customize it however they'd like. Yeah.
Right on. Okay, well, why don't you tell us a little bit about the Hello Mental Health side of things and just the virtual care platform that you guys launched? Because that's been around for predating ScribeBerry even.
Yeah. So, I mean, similar motivations, I think one, I've always had an interest in mental health. So electives and residency were kind of mental health heavy. And, psychotherapy, counseling, I've always enjoyed that. So I think that's number one. Like, I genuinely enjoy mental health work. And so kind of how it started was, when I had my family practice, I always noticed there's a gap. And I'm sure you've noticed that as well, like just in terms of that counseling, psychotherapy piece. And so it was around the time of the pandemic. I obviously had this patient panel, and I had young kids at home. I think my son at that time was really young. No vaccines, and I was like, I got to do something. I don't want to bring COVID home, and so hence the pivot to kind of Hello Mental Health and a virtual mental health platform. So it's kind of a combination of kind of circumstances and the right timing, I guess, and then also just an interest that kind of pushed me to launch this with my wife. So my wife and I, Sheila, as you've met her, she pretty much is the boss, really. And we kind of started this around the pandemic, and it's been going well. Yeah.
How many patients have you guys seen so far come through the platform?
I have no idea. I honestly don't know. Yeah, many. So we always try and keep our wait list like to about a month. Lately, we're kind of at 3 to 4 months. It's hard, and I think the rate limiting step is actually finding doctors with training or special interest, or just the willingness to kind of learn about mental health therapy, whether it's CBT, DBT, etc. And then most docs, who work for us, like just do a few hours a week or a few hours a month, or they take on locums. Nobody really wants to dedicate, except maybe for you and I, like a larger chunk of time to it, because for some, mental health work can be quite exhausting emotionally. So, yeah.
Incredible platform, though, solves a huge need. Like, I imagine the demand from the patient side is virtually infinite. Like, just especially the last few years post-COVID, mental health has been one of the biggest concerns facing like the entire population. And as you know, from having a family practice, like a huge chunk of people just can't afford counseling. Like psychologists, it's all privately paid. So many people don't have funding or don't have access through a plan through work. And so that's one of the like great things about the platform working with physicians. It's covered by your Alberta healthcare insurance plan. So it really opens things up for all those patients who otherwise couldn't have had any counseling.
Yeah, exactly. And I think like, I mean, the two biggest kind of populations we serve are one are going to be rural patients who literally have no access to any mental health services unless they have like a PCN. And then even then, sometimes it's just very variable. And then otherwise, people who have been to a psychologist and can no longer afford any therapy and just need some counseling, right? So we kind of fill that niche and fill that void, and provide that service to patients.
So what does a doctor need to know to get started? Obviously, you don't have a 4-year psychology degree, but having that special interest, having done like some weekend courses in CBT, what's sort of that barrier to entry, or what's that minimum?
So, I mean, first, we don't claim to be psychologists. I think that's really key, right? Like, so, in the screening interview, we'll often mention, this is a service provided by doctors. And so, in terms of barriers to entry, it depends really what we do is doctor to doctor. One, assess like, do you have any previous training? If not, we provide kind of a program that they can actually go through. It's very similar to kind of the residency teaching that I do on like mental health counseling and therapy. So we go through different modalities, so CBT, DBT, a lot of trauma focused kind of therapy modalities, ADHD, behavioral modification style stuff. And self-esteem work. And so just to get a broad overview and more like specific details on like, what do I need to know? What's the foundational model behind this, the evidence behind it, how does it work, and how do you practically actually do some of these things? And then from there, if the doc doesn't feel ready, they could kind of shadow myself or someone who has more experience and just get a better feel for it. And then if they, then feel comfortable or don't feel comfortable, we would start really slow, right? So one patient, after the visit, maybe debrief a bit. So, I mean, it depends. And some docs are just ready to go, like, hey, let's just go for it. Like you. So,
you can kind of, the nice thing about it is you can pick like a specific vertical, or, like I only want to see patients dealing with ADHD or something that makes it a little easier to kind of get your foot in the door and feel comfortable. Like you don't have to have the entire breadth of psychology experience and wisdom, right? But you can kind of grow your skills and expand that skill set over weeks and months and years, even depending how far down that rabbit hole and how far down there you want to go and develop your skills as a therapist.
Yeah. So we've had docs who just start out with, CBT, like, okay. Because I mean, it's what we get the most training on, if any. And then from there, they've kind of expanded out, like, okay, I could pick up like maybe a bit more like self-esteem focused stuff. Okay, let's maybe do a bit more ADHD. So it just kind of depends again. Yeah, but we're pretty flexible. I mean, we try our best to help out if any docs need any help at all. But most people have been pretty comfortable, most of our docs. So it's been going well. Yeah.
And so, personally, my experience seeing patients through Hello Mental Health has been fantastic. If anybody out there is listening and interested, I'm assuming you guys are still hiring and looking for more help.
Yeah, always. I mean, our wait list, we don't like to see it grow, to be honest. But yeah, if anyone's listening, it's fully virtual and 12% overhead. So probably the best deal you get, but definitely contact us.
Flexible hours, you can wear sweatpants, do it from home. It's a good time.
Exactly. No labs, no tasks.
Yeah. Where do they find you? What's your website?
Yeah, just hellomentalhealth.ca. Or you could email us hello@hellomentalhealth.ca. It's a lot of hellos in there, but just reach out any which way, or through Cherry, to be honest. So you guys could find us on there.
Cherry.
Yeah. Maybe not now because I have to renew my subscription. But, yeah.
Awesome. Well, Dr. Moloo, thank you so much for joining us. If you have any final thoughts, feel free to throw them in there. But otherwise, thank you so much. It's been fantastic. I really appreciated getting your insights, and love just talking with other movers and shakers in the industry. So thank you for really pushing and moving the Canadian healthcare system forward. Appreciate it. As a user of both platforms that you've been working on, genuinely really like both of them. So thank you.
Yeah, no, thanks so much for like taking the time and actually sitting down and chatting with me as well. Yeah, no final thoughts. I mean, just anyone can try ScribeBerry. So, if anyone wants to, just go scribeberry.com and it's literally 2 clicks and you can get your free trial and check it out. Yeah, happy to answer any questions if anyone, ever needs to reach out. So I'm pretty accessible as well. So, yeah.
Awesome. Okay. Thank you again.
Awesome. All right. Take care, Jordan.